Actually, it used to be difficult, or we didn't like those subjects when we were studying our course. But this time it was on application level. And she applied it directly. Okay, you have to apply to this patient or this particular case. So it was applied directly rather than mugging up all the definitions or medicine names or doses. Instead of that, she was applying it to giving different. Actually, she gave a lot of live her experience cases.
Hi everyone, welcome to Elite Expertise. I am Ashutosh Dikshit, and today once again I'm joined with one of our successful OPRA candidate who recently cleared her March 2026 examination, Tania Sebastian. So Tania, welcome and congratulations on your OPRA success.
Thank you so much.
So Tania, tell our viewers about yourself. What did you study, where you belong to, and how you got to know about this OPRA examination?
My name is Tania, as Ashutosh already introduced me. So I completed my PharmD degree in 2017, and I've been working in a tertiary care hospital in Kerala for the past years. So for the last 2 years, I've been planning to migrate to a foreign country. So I've chosen Australia to be a better plan. So for that, I had to clear the OPRA exam. One of my friends has already been studying OPRA, and she completed her OPRA exam in the last July. So I asked her about suggesting some agencies or tutoring centers to crack the exam. So she told she had chosen Elite Expertise. So she told it's a very good option. So I thought, okay, let me try that. And I think that was the best choice made and could clear it in one go.
Okay, Tania, you mentioned that you were working while preparing for your examinations, right? You were working.
Actually, I resigned from that job. Then, yeah, for cracking the exam, I resigned it. I was not working at the time.
Okay, so you were solely focused on your OPRA exam preparation. So how did you prepare for this exam? How much time it took, and what was the syllabus like? There is something called Therapeutics that almost has half of the paper, right? Or what made you think that yes, this syllabus is something that requires me to be focused and get some time off from my job and be focused on the content that is there?
The syllabus, actually, it's a vast syllabus. I don't think without support or guidance we could crack it ourselves, because when I went through the syllabus, it was in therapeutics, everything. So only with a guidance or proper guidance, especially in case of elite expertise, our teachers Harika ma'am and Arief, so they are working in Australia. That's actually at an added advantage compared to other institutes. I've actually searched around 2-3 institutes, and I've come to a conclusion about this elite expertise. And as I had a 1-2 year gap before attempting the exam, so the subjects were a bit a difficult side. And my marriage was before in the month of December, so I was actually confused whether to give the exam in March. So I've asked Harika ma'am whether I should opt for this exam, this March, or should I go with July. But she did give me very much confidence to go forward to attend the classes, and that definitely helped me, because I was not sure whether I could crack this exam in this go, because I couldn't attend the classes as per the schedule. I was back for behind about 10 or 10, 5 to 10 classes I was behind actually. But then I could cope up with, by attending 3 classes per day, I could a bit come to this track with the online classes. But still I was behind. But then the revision classes helped me a lot, because it included every topics that covered the exam. So that did help me a lot. Even the topics, even the exam, questions that were not included in the mock test were discussed in the revision classes. That did help me. And the last 2-3 days, I did struggle, study a lot. And with their guidance, definitely. And the experience here and the teachings they have gained from the experience in Australia is a bit different. And the methods, the treatment guidelines, they follow different guidelines. So I don't think to an extent the experience did help me, but it's not exactly the same as the experience or the guidance they have given from the Australian guidelines. That's different. And the exams were from their point of view. So we had to include that as well. So their guidance did help me. And even they build a foundation without going directly into difficult topics. The foundation was built properly so that the difficult topic I was doing my degree course, the topics seemed so easy when we took classes. Like the CNS system, ANS system, it was didn't explain very easily compared to my degree classes actually.
So Tanya, you mentioned that it was a bit challenging for you to continue with the classes, and it was also time taking because you were also confused whether you will be able to attempt this one or not, or you will skip this one. But Harika ma'am gave you some confidence, and you tried and you passed it. So, how were the classes like? Were these classes interesting, or were these classes were overwhelming? How you managed your time in all this?
Topics we learned, but it was in a different way. Actually, it used to be difficult, or we didn't like those subjects when we were studying our course. But this time it was on application level. And she applied it directly. Okay, you have to apply to this patient or this particular case. So it was applied directly rather than mugging up all the definitions or medicine names or doses. Instead of that, she was applying it to giving different. Actually, she gave a lot of live her experience cases. So that helped a lot. So it was not boring or overwhelming. Although I had to catch up with a lot of sessions that I had couldn't do because of my marriage, but then that helped a lot because it was easy to follow those cases. It was not just taking the class. It was not robotic actually. She was taking all the experience she gained through her work experience and those cases, live cases, that helped during exams. We could remember like that.
So you have very beautifully described that ma'am and sir used to describe the concepts based on their personal experiences that they had in Australia working as a pharmacist, right?
Definitely.
So do you think if they were not working or practicing in Australia, it would have made a huge difference, or if it was for any
Yes,
other
that would
coaching?
that Yes, that is definitely the major advantage I see here because they work and they teach. So they apply directly while teaching it. So they are not just supervising or just lecturing us. They're taking the experiences, the day-to-day experiences. I thought I attended actually the July 2025 classes. That's completely different from March 2026 classes. So for each sessions, they're recording new classes with new examples, even if there is any changes in the syllabus or the questions or the guidelines. They're changing it in the new classes. So when we attend the class, only then we'll get to know the new changes or new guidelines, new examples they have come across while working during that period. So it's very good. That is the major advantage, I think, over choosing elite expertise because both of them are working.
Okay, thanks for
I
your
think
kind
they'll
words.
definitely help in my exams after internship.
Yeah, so you very beautifully sufficed, and thanks for your kind words. So, Tanya, if someone who is just getting started to prepare for OPRA and who wants to know how to get started, what is the roadmap, whom to trust, and what should one follow? So, what your advice, piece of advice would be to them who are hesitant to talk to someone, who are hesitant to seek some guide?
Okay. I think you should contact the elite expertise. They have a lot of people working behind it, and the skill assessment that should be done first. They'll be done within a couple of 2 days maximum. That's done easily. Then you just start the course and follow the schedule and start listening to the lectures. That's it. I think that's the easiest way to crack this exam. completely listen to lectures, because only these lectures is the foundation, and then you can crack the exam. And then we have an application. In that we have mock tests. Follow that mock test. It's very simple. If we follow it routinely, I think we can crack the exam. It's easy. It's not complicated. We don't have to go for other books or other references. It's just these lectures and the mock tests. Nothing else. We don't have to hurry or go behind other books or other lectures or anything else. Just the lectures they have been recording. I think